for having us here. And we just met recently, and you told us about this Walk Texas and More program, and automatically, I, who am with Smart Trips, was very interested, and my coworkers as well, the other ambassadors, Brian and Jake, and first of all, you seem like a super nice person, so we just wanted to get to know you more, and then hear about this program that y'all are participating in and making happen. So if we could maybe hear from you a little bit of the history behind it, how it got started, and just kind of set the backdrop for it.
Well, first of all, thank you for coming over. It's good to see y'all again, both of you. And it was really great to meet with y'all and talk about how our programs could work together, because they're both about living more actively, with active transit, with moving your body more. And Walk Texas, it's called Walk Texas and More because it's more than walking, it's moving more. We know from recent findings that the guidelines emphasize now that every move matters. And so if you can't do 30 minutes all at once, do as much as you can. Stretch when you get up, fit movement into your day more and more. And so that's the goal of Walk Texas, is to help people move more and exercise and increase their physical activity for health benefits and for chronic disease prevention.
Yeah, I really like that you touched on just kind of fitting it into your schedule, because sometimes, when programs like this promote being active, it can be a little daunting, but y'all make it sound like, oh, it doesn't have to be like that. You can just fit it into the pockets of time that you do have, and just kind of fit it into your day that way. Is that about right? Or?
Yes,
okay.
Yeah, that we've learned over time. It's been around for a while, the program. We've learned over time and through feedback and process evaluation of the program, that it has to be something that people can fit into their lifestyle. And so not everyone can meet at the same time of day, every day, or 3 times a week. And so it has a lot of flexibility in the structure of the Walk Texas and More program, and a 10-week challenge, so that people can find buddies within their group and exercise together, or go for a walk, or have a walk and talk meeting at work, for example. All the participants get a participant guide, and it's a chart with so many points for every 30 minutes of different types of physical activity. The more intense the activity, the more points you get for every 30 minutes. And again, like I said before, it doesn't have to be 30 minutes all at once. If you break it down into 10-minute sessions, or however you can fit it into your day. Every move makes a difference in your health, and it all adds up. The program was actually created at UT School of Public Health in Houston, Texas. And a gerontologist, Dr. Vilma Falk, and her graduate students were working on creating a program that had the most significant improvements in health for aging adults. And so they created Walk Texas.
Very cool.
Then the Texas Diabetes Council program at the state level adopted Walk Texas and required all of their community-based grant-funded programs throughout the state to include Walk Texas as one of the programs within the community-based projects. One of the things that we had to learn the hard way is, when we first started, staff would go and walk with the residents, like in low-income areas. The residents became totally dependent on staff, because if we weren't there, they wouldn't show up, or they wouldn't walk. And so over time, we've learned to create it as a more empowering program. The program is for adults age 18 or older in Austin or Travis County. And so someone from the group who's an adult has to agree to be a group leader. And then the group leader is my central point of contact.
Oh, got it. So then are they the ones that send you all of the reports, like all of the sheets where people are keeping track? Or ideally, in an ideal world, or how does that tracking work?
Thank goodness. I don't ask people to turn in their logs.
Okay.
We use a lot of motivational techniques.
Got it. Okay.
There's a lot of different types of groups. When I said we want to empower people to fit it into their own lifestyle, we do provide a group leader training, talk about safety, heat safety, physical safety, personal safety. The group varies in what type of group it is. If a person finds out about Walk Texas, they call me up. I let them know, well, if you want to have a group, just start asking people around you, find out who's interested. And so they recruit people. They may recruit people that they see every day, like in the work site.
Okay.
They may recruit a coworker and a family member and a community organization member. You know, a lot of people.
It's for everybody.
Don't know it. So if you have a group like that of people that don't know each other and they have different lifestyles, different jobs, things like that, it's really hard to get together even once a week, every week for 10 weeks during the 10-week challenge. And so with those types of groups, I ask them to meet at least twice in the beginning and go and do something fun. Where are you moving more? You could take a guided tour, the historical district, downtown Austin. I mean, we have so many nature preserves. You can have a guided tour of the nature preserves that we have here. We're so lucky. You can go bowling. But the main, just moving more. Washing windows, flex on, flex
literally
on.
anything. I had a friend who plays elevator, or she calls it elevator or stair roulette, where she gets in the elevator and then whatever, like if there's other people there, whatever number they press, that's where she's gonna get off. And then so if they press 3 and she's on the 8th floor, she then has to climb the stairs all the way to the 8th floor.
I love that.
It's like it's just I mean, you talk about incorporating it into your everyday life, like you're already there, you know, and so you just kind of work with it.
Recently, we had 2 really great group leaders, one here at the Seminary of the Southwest who recruited over 34 people.
Oh my goodness.
And I think it was like 80% of them completed the 10-week challenge.
Wow.
And they would go hiking together, they would get together and do, you know, all types of things just for fun. And so it built community, and that was one of the things that I saw in a lot of the evaluation forms was how much they appreciated the group leader and how motivated they felt, because they knew she was going to ask them how many points they had for each week. And that's a motivator. We just want want to report something. When you're meeting everyone in your group and you find someone who lives near you or likes to do what you like to do, you know, hopefully it's a person who goes a little bit faster than you or about the same pace as you, and y'all increase together. If it's someone who's like a marathon runner and starts running off, this program wouldn't be very interesting to them. It's basically for people who have not been active in a long time and just need a little bit of structure.
So you mentioned incentives and there's points. So how do those two things kind of tie in together?
Well, there's a point chart. Every possible way that you can move more is not on that point chart. So if what you're doing is not on that point chart, there's one little option for other, and so it's like 6 points for every 30 minutes. The points add up every week. The group leader asks their members every week at the end of the week, what's your total points for this week? And so the motivator, really works. It really does. At the end of the 10-week challenge, they have their total points. And we based our point system off of the Lieutenant Governor's Challenge of Delaware.
Oh my gosh.
All
the
Walk
states
Texas,
are involved.
Walk Texas has been around a long time, and this was a program that I learned about at a conference. It was a national conference for physical activity and public health. It was the Steps to a Healthier U.S.
Oh,
conference.
okay.
And so it was a best practice program, and it was a great place to start with a point system. So the basic incentive for the 10-week challenge is that you can earn a gold, a silver, or a bronze,
like the Olympics.
bronze medal.
Mhm.
And they're little pendants.
Aw.
It's not real gold, sorry.
Oh.
But
I mean, not quite like the
it's,
Olympics.
it's important though,
Okay,
you know,
yeah.
because we tend to give our time to our family and to others and
Yes.
talk ourselves out of taking care of ourselves a lot of times because we're
Yeah.
tired, we've had a long day.
Yeah.
And so this is just a fun program and a fun way to,
Yeah.
you know, be conscious of it and to think of ways to move more throughout the day.
Yeah.
And then in the end you get your medal. So
No, that's awesome. That's awesome.
years back a large business in Austin participated and they had several groups.
Okay.
Another thing that I provide the group leaders is a wall chart, and it's laminated so you can put a person's real name if they want, or
Cool.
they can
Yeah.
pick their favorite superhero,
Yeah.
or you know, if it's a faith-based organization, they've picked Bible characters,
Oh, okay, yeah.
people in the Bible, and so whatever they use. Those teams have their own boards and they place them next to each other
Oh.
near the elevator.
Wow.
And so
Wow.
point of
Okay.
decision prompts are also
Yeah.
another way to remind people, hey, you can
Yeah.
add a little movement in your day.
Yeah.
Don't have to change clothes or go to the gym. You just,
Yeah.
you know, take the
I
stairs, or
love
while
that.
you're waiting for the elevator, if you're not able to take the
Mhm.
stairs,
Yeah.
you know, just stretch
move.
out,
Yeah.
just move as
Yeah.
however you
Yeah.
feel like your body needs to move. So it's bringing attention back to the body and
Okay.
what we're feeling inside. A lot of people go through their day unaware.
Yeah.
And it's amazing if everyone knew how many benefits we get from moving more, from exercise. We have so many benefits on the cellular level. Every system in the body, every part of the body, the brain, nervous system, every system,
Yeah.
muscle, tissue, it all gets more efficient. It all gets stronger and better.
Yeah.
And so even our genes, our genetics,
Mhm.
at the end of our genes are telomeres.
Telomeres, yeah.
Yes.
They're like
They're like
I
little
think
caps.
genetics. Yeah, one of the big things that they would tell us is like it's important to sleep or else your telomeres wear down because they're like shoelaces. And so they like start to wear down at the ends, and then every time you like your DNA replicates, like it's less and less efficient each time.
Yes.
So.
And you
yeah,
can reverse
yeah,
it
yeah.
with exercise.
With exercise.
With moving more.
Yeah, just move. Just move more.
It's awesome.
Yeah.
Yeah, and for
But,
children,
yeah.
you know, their movement, their exercise is play.
Yeah.
And they can go all day, like the
Yeah.
Energizer bunnies, you know,
Yeah.
nonstop. And so, general guidelines for all Americans suggest that children get at least 60 minutes a day,
Okay.
most days a week.
Okay, so maybe, this isn't really a program for kids, but, as parents or, aunts and uncles and everybody starts becoming more active, maybe they'll be more likely to even play with their kids maybe, or,
And that's
yeah.
exactly where
Yeah.
we try to reach out to
Okay.
parents,
Yeah.
to childcare provider programs, to people who have pets. You know, you
Yeah,
can be
yeah.
a dog mom, or
You can be whatever you want.
It doesn't
Yeah,
matter.
yeah.
You can be a single person. It doesn't
Yeah.
matter what your lifestyle. It's very doable to fit the 10-week challenge into your schedule.
Yeah.
The program that I work with is the Chronic Disease and Injury Prevention Program through
Yeah.
Austin Public Health. Chronic diseases like diabetes, heart disease, stroke, leading causes of death, leading causes of morbidity or illness, loss of life, loss of
Yeah.
years lost, quality of life. They affect your quality of life, not just how long you live. And we know from so much science, so many studies that have been replicated, that are valid and reliable, that moving more improves your health. It may not always happen on someone's timeline, like
Yeah.
if their goal is to lose weight,
Mhm.
we ask people to focus on time,
Yeah.
not the body, because the body's going to do what it's going to do, and
Yeah.
on average, everyone gets the benefits
Yeah.
over time. But it increases your energy
It's an
immediately.
investment. It's an investment in yourself, and then, and even those around you, I would say, because I had a friend who, his mom was about to have a grandchild, and then that really kickstarted that kind of feeling like, oh, I need to take care of myself because I need to live long enough to spend more time with my grandchild. So, yeah, I think it's
There-
Okay.
That's
Yeah.
awesome. Because
Yeah.
one of my
Yeah.
sayings to people is, you got to keep moving so you can keep moving.
Yeah.
It's really important to move the body. Our bodies, no matter what your age or stage, your body size, our bodies need movement. For people with disabilities, our bodies, whatever parts of the body you're able to move, it's good for your health. It's good for your brain. It's good for your memory, your
Yeah.
cognition.
Yeah. Multiple benefits. Multiple benefits. Yeah.
I couldn't name them
Myriad.
all. If you're interested in Walk Texas, it is a free program. The only requirements are that we have a registration format,
Okay.
survey
And
at
that's
the
on your
beginning.
website or?
It's on our website, and it's
Okay.
also available for hand copy. Not everyone.
Yeah.
I mean, I know the web, the World Wide Web,
Thank you for
internet
mentioning that. Yeah.
is very
Yeah.
popular, but
Yeah.
not everyone wants
Yeah.
to do it that way. Some
Yeah.
groups still use the paper forms,
Right.
and that's fine. So they can call me, they can email me, and they can go on our website. One of the web addresses that we have is called Healthy Places, Healthy People.
Okay.
We know that if we change environments to make them more inviting,
Mhm.
to move more, like for example, the stairwell, putting posters of nature scenes in the
I
stairwell.
saw your posters.
Yes,
yeah.
we did that.
And really, I was like, oh, I kind of want to keep going just to see the posters. It's like, what are they going to come up with next? So,
Yeah, there's so many
it's
things
fun.
you can
Yeah.
do. Other cities in Texas that have adopted Walk Texas may look different.
Yeah.
With Austin and Travis County, we can go outside of the city limits.
Okay.
My job as a public health educator too,
Yeah.
I can go to Manor or Del Valley or anywhere in Travis County
Okay.
and help people start their own groups.
Oh, very
It doesn't
nice.
have to be a walking group, but it can be. You can have a cycling group or a hula hoop group.
Yeah.
Oh, that's what I was
Yeah.
going to tell
Okay,
you.
yeah,
With
please share.
one of
Yeah.
the organizations,
Yeah.
they had the posters up,
Yeah.
but they also had a hula hoop contest.
I have a friend that it's actually difficult.
It's
people
really
think-
good app
Yeah.
workout. Yeah.
People think, oh, whatever, they dismiss it, but no. I have a friend who kind of does this as a hobby, and she was trying to teach me and another friend, and it's difficult. Yeah, it's a workout.
It's
a
fun,
workout.
too.
Yeah, and it's really fun. You can go crazy with a hula hoop. Yeah, very cool. Thank you for sharing that. Actually, I had forgotten about that. Well, awesome. So lots to do, lots of options. And we're gonna have Sabrina's contact info, so you can start your own group. And we'd love to hear more about it. And thank you for doing this with us.
Thank
Really,
you so much.
Yeah,
It's
this was
a
really
total
great.
pleasure.
Yeah.